it is not uncommon for patients who are suffering from temporomandibular joint disorders to have pain when they try to open and close the jaw. Also, the amount of mouth opening tends to be limited in the sense that you cannot open as wide or make jaw movements like other normal individuals. This video is all about explaining to you the value of home physiotherapy, which deals with first releasing a muscle, then stretching a muscle, and then strengthening the muscle. I will run through this in the form of 4 different sets of exercises that I strongly recommend for you to perform in the sequence that is mentioned. It always helps to start with a warm-up. Just like before we start lifting heavy weights in the gym or we start playing a football match, we want to warm our muscles up so that we don't land up injuring them. So let's say if you have face pain, you start with using a warm towel or a warm water bag and then warm these muscles up before you start actually working on them so that you don't land up injuring the muscle. This is, however, optional but strongly recommended. The first series of home physiotherapy deals with something very simple. It's called as soft tissue mobilization, which basically deals with gentle massaging in a circular manner over the muscle that is giving you pain or discomfort. It is important that you make sure that the teeth are not clenched together when you do this release exercise. Let's say you have pain in the cheek region. All you do is you take your fingers and gently rub that area in a circular manner. If you have pain in the temples, you do the same thing. This is a simple massage. It is again something that improves blood circulation into the area, preparing that muscle for what is coming next. Next is passive muscle stretching. Now this basically involves simple jaw movements, making sure that when you make these jaw movements, there is no pain associated with the movement. That's very, very, very important, because remember, pain precipitates more pain. So a basic rule of physiotherapy is do not do any exercise that is causing you pain. Reduce the range of movement or reduce the amount of pressure that you apply and then continue with the exercises. This involves an open-close movement, a side-to-side movement, and also a forward and a backward movement. And you do each of these 10 times. So simple thought here is open and close your jaw, provided there is no pain. Simple. What you could do is hold your tongue to the palate and open and close without releasing that contact. This will make sure that you don't land up traumatizing the muscle. You do the same thing for side to side. And forward and back. You do these each individually 10 times. So you open and close 10 times, you go side to side 10 times, you go forward and back 10 times. This is the second in the sequence of exercises. It's called passive muscle stretching, and as I just explained, 10 reps per exercise. Next comes something that's a little more aggressive, which involves active muscle stretching. Your jaw movements are made with assistance from your own fingers. Okay, this is basically an open and hold exercise, and you hold for 15 seconds. Very, very important is the opening should be gradual and not forceful. Let me explain how you do this. You take your index finger and you place it on the lower front teeth. Your thumb goes and contacts the upper front teeth, and then you push the fingers apart, and when you do that, you land up stretching the muscles of mouth opening. So let me show that to you. And when you stretch, you hold that stretch for 15 seconds. Once again, you do this 10 times, which means 10 reps of open and hold 15 seconds. This, friends, is active muscle stretching, which helps lengthen the muscle. So the first 2 exercises were about releasing the muscle. This is about strengthening the muscle. And the last exercise is about strengthening the muscle because it is a resistance exercise. Here you are actually making jaw movements against force from your finger muscles. There are 3 movements here: open and oppose, you then have side and oppose, and then you have a forward and oppose. These again should be gradual and not forceful. Let me explain each of these individually to you. What you first do is open and oppose. So you hold your thumbs underneath your chin, you open the jaw just a little bit, and then you try to force the jaw up with your fingers as you try to push the jaw open further. But these movements or these forces should be equal to each other so that the jaw remains in a static position. Let me explain this to you. Holding the thumbs and I'm pushing the force up whilst I'm trying to open the jaw downwards. So what I am doing here is resisting the downward movement of the jaw by the upward force from my thumb. So there is no jaw movement because the forces are equal. Once again, you push and you hold for 15 seconds. If this exercise causes pain, please reduce the amount of pressure with which you are holding. Remember, we want no pain. So this was the first one, which was open and oppose. Let's look at side and oppose. What you do is you take your fingers and hold it on this side and then push the jaw towards that side and give resistance. I take the jaw towards this side and then I start pushing. I'm sorry, I sound weird, but this is how I want to explain this to you. I'm pushing with my fingers in, and as I am pushing my jaw out, what this does is it provides resistance to this area and this area because these are your primary TM joint areas. Now remember, of importance is first to relax the muscle, stretch the muscle, then strengthen the muscle. So please don't start doing these exercises until you have been recommended to do these. This was the side resistance towards the right side. Do the same thing towards the left side. Push the jaw towards that side and resist. With the fingers, hold for 15 seconds. The last one is a forward and oppose. So you hold your fingers ahead, push the jaw forward and try to force it back. So all I am doing is opposing the backward force from my forefingers by using the muscles that push the jaw forward. This is a very important exercise because it strengthens a very, very critical muscle which is called as the lateral pterygoid muscle. So these are a set of exercises that you are supposed to do in the correct sequence. Very important is to make sure that it does not cause you pain when you are doing these. Once you go through all of these 4, you have completed one particular set. And now remember, you are supposed to do this set 6 times a day. I love to say this: God helps those who help themselves. There's only so much that we as clinicians can do for you. It's up to you to make sure that you continue the process of strengthening yourself so that we're not just going into a pain-free life, we're making sure that we stay pain-free. We don't want the problems to come back again. Also important is when you're making these movements, especially the open and close, try to do this in front of a mirror and try to see that your movements are symmetric and in the midline. This is especially important for those who tend to deviate the jaw towards either side. This is me trying to help you explain home physiotherapy. Dr. Moez Kakiani signing out.